Title: The Loneliness Trap. How Loneliness Worsens Your Mental Health. Introduction. In today's networked society, loneliness has become a frequent issue with serious ramifications for mental health. It is not merely a transient emotion. Persistent loneliness can have harmful repercussions on our well-being. This article covers the delicate relationship between loneliness and mental health, covering the physical implications of loneliness, its emotional impact, and techniques to overcome it. What are the 3 physical effects of loneliness? 1. Weakened immune system. Research has revealed that loneliness can impair the immune system, leaving people more susceptible to illnesses and infections. Chronic loneliness produces elevated amounts of stress chemicals, such as cortisol, which impair the immunological response. Consequently, lonely individuals may endure more frequent diseases and longer recovery durations. 2. Cardiovascular health issues. Loneliness has been related to an increased risk of cardiovascular disorders, including high blood pressure, heart disease, and stroke. The persistent stress associated with loneliness can lead to inflammation, increased blood pressure, and disturbed heart rate variability, contributing to the development of cardiovascular diseases. 3. Sleep disturbances. Loneliness can alter sleep patterns and quality. Sleep plays a key part in preserving mental and physical health, and persistent loneliness can contribute to insomnia, disturbed sleep, and poor sleep efficiency. Sleep difficulties further worsen feelings of exhaustion, mood changes, and cognitive deficits. Why is loneliness so painful? Loneliness is sometimes described as a profound emotional suffering coming from a perceived absence of meaningful social ties. Evolutionarily, humans are social beings, built to seek connection and belonging. When these social demands are unsatisfied, the brain's pain areas, such as the dorsal anterior cingulate cortex, might be engaged, leading to feelings of sorrow and suffering. What is an extreme feeling of loneliness? An intense experience of loneliness is usually referred to as chronic loneliness or existential loneliness. It extends beyond momentary or situational emotions of solitude and endures over extended periods. Chronic loneliness reveals a severe sense of isolation, when individuals feel profoundly misunderstood, socially ostracized, and lacking deep, meaningful relationships. How is loneliness unhealthy? Loneliness can have harmful impacts on both mental and physical health. From a mental health standpoint, loneliness is significantly related with an increased risk of developing depression, anxiety disorders, and suicidal ideation. It can exacerbate underlying mental health disorders, making it harder for individuals to rehabilitate and participate in appropriate coping mechanisms. Physically, loneliness can weaken the immune system, contribute to cardiovascular difficulties, and affect sleep patterns, as discussed before. How do lonely people behave? Loneliness can express in various ways, and individuals may display diverse behaviors as a result. Some frequent behavioral habits among lonely persons include: 1. Social withdrawal. Lonely individuals may retreat from social engagements, shunning opportunities for connection owing to fear of rejection or a sense of hopelessness. 2. Increased sensitivity to social cues. Lonely individuals may become hypersensitive to social cues and perceive ambiguous situations as signs of exclusion or rejection. 3. Heightened self-focus. Loneliness can lead to heightened self-consciousness and self-preoccupation. Individuals may ruminate on negative ideas, focus on their loneliness, and fail to look beyond their own imagined isolation. How to overcome loneliness? While conquering loneliness can be tough, there are ways that can help. 1. Foster social connections. Actively seek out opportunities to meet new people, join social groups or communities, and engage in activities that correspond with your interests. Building lasting relationships takes time and work, but the rewards are worth it. 2. Cultivate self-compassion. Develop self-compassion and practice self-care. Treat yourself with care and understanding, acknowledging that loneliness is a common human feeling and not a reflection of your worth. 3. Seek expert support. If loneliness persists and adversely damages your well-being, consider obtaining support from a mental health expert. Therapy can provide significant information, support, and techniques to treat loneliness and its underlying causes. Why do some people enjoy loneliness? While loneliness is often connected with unpleasant emotions, some individuals may love alone and find it advantageous for their mental well-being. The crucial contrast resides in the voluntary character of the seclusion. Enjoying isolation allows for self-reflection, creativity, and a reprieve from social demands. It becomes troublesome when it turns into chronic loneliness, characterized by a lack of options and meaningful interactions. What does loneliness do to the brain? Loneliness can have quantifiable impacts on the brain. Neuroimaging studies have demonstrated that lonely individuals may have structural and functional variations in brain areas related with social cognition, mood control, and reward processing. Loneliness can alter brain circuits connected to self-referential processing, boosting negative self-perception and enhancing vulnerability to social dangers. What does psychology say about loneliness? Psychology considers loneliness as a substantial risk factor for mental health concerns. It stresses the importance of social connection in creating well-being and emphasizes the necessity for measures to prevent loneliness and its accompanying misery. Various therapeutic treatments, including cognitive behavioral therapy and interpersonal therapy, can help individuals address the underlying causes of loneliness and establish healthier social behaviors. Is loneliness treatable? Yes, loneliness is treatable. It involves a multifaceted approach that includes individual effort, social support, and professional assistance. Therapy, support groups, and social interventions can provide tools and tactics to alleviate loneliness, increase social skills, and promote a sense of belonging. Does loneliness affect personality? Loneliness can alter personality features and behavioral tendencies. Lonely individuals may demonstrate higher levels of introversion, social anxiety, and self-consciousness. The experience of loneliness can influence one's viewpoint, affecting how they perceive themselves, others, and social relationships. However, it is vital to highlight that loneliness does not determine personality, rather, it might contribute to specific traits and behaviors. Conclusion: loneliness poses major dangers to mental health and physical well-being. It is vital to identify the deep impact of chronic loneliness, comprehend its physical and mental implications, and take proactive actions to overcome it. By cultivating social connections, receiving professional treatment when needed, and practicing self-compassion, individuals can overcome loneliness and create a happier, more rewarding existence. Remember, you are not alone in your loneliness, and there is hope for brighter days ahead.